How often should I have an eye examination?
We start eye examinations with the first screening exam in the first month after birth. After that, we continue with checkups at 6 months and 1 year, and in the following period, it is necessary to continue eye examinations with annual checkups.
How does working in front of a screen for long periods of time affect eye health?
This is a problem we encounter very frequently nowadays. In almost 70 to 80% of the cases we see in daily life, computer use is present. Because everyone has a mobile phone, uses a computer and uses a tablet. Especially from childhood onwards, this frequency has increased significantly. The important point to pay attention to here is to reduce the amount of time we are exposed to screens each day. Because the more the eyes are exposed to screens, the more they are exposed to light. And the blue light, which is especially present in this light, significantly affects eye comfort. At the same time, since our blinking reflex decreases, it leads to dry eyes. This is particularly important for us both before and after surgery. In patients undergoing laser treatment or cataract surgery, it both affects the measurements and prolongs the patient's recovery period after surgery. For this reason, we apply the 20-20-20 rule to our patients. Here, after the patient looks at the screen for 20 minutes, we ask them to look out the window at a distant point about 20 feet away for approximately 20 seconds. In this way, we are able to provide some benefit to our patients.
How can I monitor eye pressure at home?
Currently, we cannot monitor eye pressure at home. Our patients have to come to us for eye examinations at certain intervals to check their eye pressure. With the various devices we have that measure eye pressure, we are able to assess intraocular pressure and adjust our patients' treatments accordingly. However, in the future, it may be possible to monitor it at home with technological devices, perhaps supported by artificial intelligence.
Is there a new method to slow down the tendency towards myopia?
Recently, especially in children with myopia, we have observed, or rather there has been a significant increase in the prevalence of myopia. Especially in our own clinical practice, we have seen a significant increase in this frequency among patients coming to the outpatient clinic, influenced by the rise in computer use. A few years ago, there was talk of a myopia pandemic, particularly in Far Eastern countries. It is still being discussed, and its effects are being observed worldwide. Our clinical approach primarily involves accurately prescribing the patient's prescription, that is, their eyeglass or contact lens prescription. Recently, in addition to these eyeglass or contact lens prescriptions, we have been able to help patients by prescribing atropine eye drop treatments, certain devices that prevent myopia progression, and also special eyeglass lenses. Research on these is still ongoing. If you ask which method I use in my daily practice, I have had patients for whom I started atropine treatment. We have started using this in some patients. Especially recently, there are two prominent companies developing special myopia lenses. We are able to prescribe these to our patients. The advantage here is both we can monitor patients more easily. In fact, if there is a change of more than 0.7 in the prescription within a year, these companies provide free lens replacement support. The other option is myopia progression devices. However, I can't really convince my patients about this because these patients need to take the device home and use it there. They have to undergo treatment either every day or at certain intervals. They need to apply these treatments. So far, not many patients, they haven't really requested it or accepted it. This is my daily approach, my approach in clinical practice. Perhaps Dr. Önder would like to add something else about this.
So, doctor, in addition, of course, we believe that benefiting from sunlight is important. We recommend our patients to get plenty of sunlight. I think it is beneficial in preventing the progression of myopia.
Especially in infancy, right, doctor? Yes, absolutely. We definitely recommend that newborn babies or children get sunlight exposure.
What nutrients and minerals affect eye health?
In other words, research has shown that foods rich in vitamin A and vitamin D have positive effects on eye health. We also recommend foods rich in vitamins A and D to our patients. This could be leafy greens, green vegetables, or carrots. Right, doctor? Is there anything you would like to add?
Yes, perhaps foods rich in omega-3 like fish oil and green vegetables are especially important here. We could also recommend reducing cigarette use. It's not a food, but as with everything else, smoking is truly harmful here as well.